Your live now?
So just let me know when I can. I'm live now.
Yeah, you're live on
Huh?
Facebook.
Okay.
Yep, it's recording.
Okay. Hello and namaste. I'm Dr. Shelly Sharma from Bombay. And before I start, I would like to thank Genoveva and Uta for giving such a wonderful platform, and also to I Love Homeopathy, Dr. Karthik, for making this process of presentation very much smooth. Before I start, as I always do, is I would like to first thank Dr. Samuel Hahnemann for giving such a wonderful science, which is homeopathy, because the depth of homeopathy can only be understood by two people. One is that who have really understood classical homeopathy in and out, and that person who has been cured of his disease or a life threatening disease, which one time would have been a hopeless case for him. So, today, with this presentation, I would like to share some of the important part of a homeopathic journey, which is case taking. So case taking is one of the most ignored part of our study. So when we go in a second year, we start with case taking, and by the time we are in our third year, fourth year, we become doctors. We focus more on what we call as materia medica learning, rubrical learning, repertory learning. We refine those subjects, but somewhere we lag behind us in case taking. But we have to understand that if we are very good with case taking, and case taking mind well is one of the most practical part of homeopathy, we can solve most of the cases. I remember my students, or when I was a student, whenever a patient just wept in my clinic, give him pulsatilla. That was it. Or whenever the patient had a history of disappointment or history of death of a relative, give that patient natural erraticum or antimproved if there is a disappointment. We never moved ahead like how is the patient weeping? Why is the patient weeping? What is the process behind the thought process and the patient is weeping? So this can only be done with a proper case taking. A proper case taking, as my guru always says, Dr. B.S. Bosle, is a proper case taking is done only when once you enter the subconscious part of a person. So let us move ahead. I would just like to tell that broadly, when you see, we have two type of takings in our clinic. One we call it as acute case taking, and one we call it as a chronic case taking. So what is the difference between acute case taking and chronic case taking? So acute case taking is that case taking in which the person jumps in with an acute disease. It can be a simple fever, a diarrhea, or a patient must be in a collapsed condition. He is in ICU, or he is in a last stage of any disease. It can be anything when we say it is an acute case taking. And what is a chronic case taking is the patient is suffering from a disease since long and is not able to recover. So another question arises, same time, how much we take for a chronic case in an acute case? So the answer obviously is no. Acute case taking is a very short process. Hahnemann himself has said in his Organ of Medicine. And chronic case taking can be from 15 minutes to 2 hours till you get into the subconscious part of the person, till you understand the person as a whole. So let us understand what do you mean by understanding a person as a whole, what is an acute case, what is a chronic case, and the whole thing which I'll be discussing or sharing you will be a very practical aspect. So, as Hahnemann said, is what is a case taking? So, case taking is nothing but when you individualize a person in your case. For example, a person comes with diarrhea, or 5 people come with diarrhea, and when you individualize every person separately, that is a proper homeopathic case taking. Your case taking should start from a chief complaint, and your case taking should end when you are done with individualizing the case of a disease. So when you have individualized means how this person is different from another person, how this diarrhea is different from another person's diarrhea, or how this human being and this remedy is different from another remedy. At that moment, the case taking ends. And Hahnemann in his further aphorism has explained that he has given some general directions for case taking. Again, the case taking may vary from person to person, from doctor to doctor, and from case to case, which we have to again individualize at our level. So we cannot follow the same process of case taking in all the cases. We have to again individualize the case taking from person to person, disease to disease, and from remedy to remedy. And the third part which Hahnemann says about is, when will you say you have a patient? When can a doctor be able to take a proper case? A homeopathic doctor will take a proper case taking only when he is free from prejudices and he has sound senses. So what do you mean by freedom from prejudices and sound senses? Freedom from prejudices means he doesn't have any pre-convict notions about a person, about a case. He himself have to be a very balanced individual. Because here, as a homeopathic doctor, we are not just diagnosing a disease, we are diagnosing a human being. We are diagnosing a individual who had a journey from his birth till death. And if we want to diagnose a person from his birth till death, we have to have a very proper sound senses and we have to be unprejudiced. We have to be a very individual, a very balanced individual. We have to be spiritually very balanced. We have to be emotionally very balanced, and sense, and we have to be what I say, a very balanced human being. I'll give an example with that. There are so many patients, they just come into your clinic, and if they have to wait, specifically the Nux vomica and platina are most difficult cases to handle. So once they are in the waiting room, they will be shouting at the patient, at other patients, or they will be shouting at the receptionist. Why the doctor is taking so much of time? How dare the doctor is taking so much of time? They don't value my time. At that moment, if a doctor who is a balanced person will understand this is Nux vomica case, I do not have to get bothered about it. And when the patient gets into it, you just match some symptoms and give him Nux vomica. So you have to yourself be a balance, because here we are dealing with emotions. So now, as I said, the aim of the case taking is to individualize the patient and the case. Till you are not able to individualize why this person is different from this, why did this person got an autoimmune disease, what has happened in this person's life, he has landed up into cancer or he has landed up into arthritis. Till we are not able to understand his journey, till we are not able to understand the person as a whole, we should not stop the case taking. We have to reach till we individualize this person. And when we are able to individualize the person, we will be able to reach the simillimum. Because here, only a proper simillimum will take care of a person as a whole. Moving ahead, I had a video of this case. Because of some technical issue, I will not be able to play the video. So I will be sharing a case to start with. As I said, there are two type of cases specifically in homeopathy. One is an acute case and one is a chronic case. So this is an acute case which I'll be sharing. So this is a case of a lung collapse, which was after a CABG. Like the patient had a myocardial infarction. After 15-20 days, this person landed him into lung infection. He took some antibiotics, and after taking antibiotics, this person ended up into lung collapse. So this female, the wife of the patient, she approached me saying that her husband was admitted in hospital maybe since 10-20 days and he had no signs of recovery. His lungs has collapsed up to 20%, and this patient had undergone a bypass surgery few months back. So so this patient, when he was admitted in the hospital, he was gasping for breath. He had tachycardia, severe stridor. Then they tried to put what do you call, intubate the patient. They couldn't intubate the patient because they found that there was a stenosis in the trachea. So you know the air pipe which is connecting your upper respiratory and lower respiratory, there was 50% stenosis in that air pipe. That means there was a swelling or there was a growth. It was not known, but because of that, the patient was not able to breathe. So they had put the patient on ventilation. And it was now 20 days past, he was on ventilation. Still his SpO2 was not rising more than 88%, and gradually his one organ started failing. He had paralytic ileus. There was a whole bloatedness in his body. His lungs started giving a lot of expectoration. He needed suction every 1 to 2 hours. He was not able to expectorate. He was on ventilation, on off ventilation, and the doctors advised them to go for a tracheal stenting. So tracheal stenting is a procedure in which there is this, what do you call, lumen is narrowed down. So they put a stent in the trachea and they just try to open the lumen, so that the air can pass properly. But the doctor said as the lung was already 20% collapsed, so there is very less chances that the patient can go through this procedure. He may collapse on the table if he is going through the procedure. So we can just wait and watch, or if you want to go for the procedure, then you have to leave it on God and just go ahead. Again, the procedure was very expensive. It was around 5 lakh rupees Indian currency, which is a very huge amount. So already that lady was drained with money. She had no money, she had loans, she was a single working woman, the husband was not reviving, he was on and off ventilation, and then the case came to a homeopath. So we go to the ICU, and when we see the patient, now when we approach such kind of cases, so this is a picture which I took. I'm not able to show the video. I'm very sorry for that, because that video was very beautiful. You could see it was a video of just maybe 30-40 seconds, and in that video you can just see the agony of the patient, how restless the patient was, how anxious the patient was. When they were doing the suction, you could definitely see the patient's restlessness, the patient's facial expression, which is very important when you solve such kind of cases. So, yeah. One minute. Yeah. So, um, again, one more thing happened was the patient became antibiotic resistant. He was not responding to any antibiotics. His lung was collapsed, and then a homeopath was called. So, as I said, the patient needed suction every 1 to 2 hours, and his disease was progressing. Also, the bills of the hospital was progressing, and I think homeopathy could help him or not. Let us see. So, this is his reports, which you can see. These are the CT scans where it is mentioned. You have ascites, you have paralytic ileus, etc. Now, what is the role of homeopathy in such kind of cases, and how we can help? That is a very important question. Now, the question arises, in such kind of cases, this is a very acute syphilitic case, it is a very progressive case. Such kind of cases, we do not have much time with the patient because patient is in the ICU. So we have to extract the maximum out of the patient for how much minimum time we are with the patient in the ICU. So such kind of cases, you have to approach a little differently. Not differently, Hahnemann has said how you have to approach. This is what I'm going to share with you. So for such kind of cases, what was there? I took his case through his wife's point of view. So what was there in his case was the patient had a lot of struggles in his life. He had changed many jobs. He couldn't tolerate injustice. He was a share market broker and he had a very sedentary life. He was a smoker, very suspicious person. These were all symptoms given by his wife. Was very aggressive person, jealous, egoistic personality. Initially was very jolly person, but since he started losing all his money, he became very jealous. He became very aggressive. He became very abusive. He doesn't want to listen to anyone at that point. And as his anger increased, as his jealousy increased, as his frustration increased, his food intake increased, obviously, which led to his cardiac condition. Now, his food desires before the attack or before hospitalization was sour, lemon, pickle, sweet, cold food. His thirst was profuse. He had fear of suffocation at night. पहले से ही, before this hospitalization, he had the symptom. He was a chain smoker and was very restless in bed. Now, Now, such condition, I have two type of approaches we can give. One was I will take the whole history of the patient right from his birth till today, and the next thing, what we can do is we can just take an acute totality of the patient, because such kind of cases, when you specifically approach a case which is very syphilitic, which is in hospital, patient is fighting life and death, you have very less time to solve such cases. You have to just observe and take acute totality. So this acute totality is the acute present state of the patient, because this acute totality, this acute present state of the patient will throw the maximum PQRS symptoms of the case, and those PQRS symptoms which we extract during the acute totality, during the observation of the patient, will lead to the syndrome. So his acute totality, what was observed in that case when I visited was the lungs could not expectorate, right? So what we observed was his lungs were weak. He needed suction. He was on medication. He couldn't expectorate. So his lungs had become very weak and they could not expectorate. So on asking his wife and the attendant, they said he was coughing. But whenever he was sitting erect, his cough was little bit okay. So this was very important modality to be taken. This was the only modality I got for the cough. I took it. So next symptom, what was there for observation was there was an anguish look in the patient. We saw that photograph also, and also in the video you can beautifully look. There was an anguish look. So there's a difference between anxious look and anguish look. In anxious, patient is anxious what will happen in future, how will I deal with it. And when there is an anguish look, there is a lot of anxiety with confusion. God knows, I'm in the hand of God, I don't know what is going to happen. Anything can happen. That is anguish look, so which could be seen when I visited the patient. So there was an anguish look, and the wife said at night, he is looking some. He's just telling, I can see this man standing. There are ghosts in the ICU. They are trying to contact me, and he says he's seeing ghosts at night in the ICU. He's not seeing for the whole day, but only at night. So this symptom was very important for me. Next was a very interesting symptom which I got. This patient always wanted to hold hand of an attendant, right? So he wanted to hold the hand of the attendant. He just wanted a nurse or a ward boy. So I asked him, if there is no nurse or ward boy, so will he hold your hand, the wife ka hand? She said he will never want to hold my hand. He want to hold hand only of the attendant who is attending him in the ICU. So this was a very important symptom, right? He want to hold hand of the attendant, which is a nurse or a ward boy. Fear of alone. At night, he cannot stay alone in the ICU. He want one person. So one ward boy was allotted with him, and one sister. She was always sitting with him. And then one more thing she said, whenever I go and meet him and I request him, Ki, you kindly try to have this, change your dress, or just try to have this soup, he used to get very angry. Whatever was said against his own wish, he used to get anger. So in this situation, we could see there was anger on contradiction, fear to be alone, want to hold hand of the attendant. He could see ghost at night. There was a lot of anguish look, cough better by sitting erect, and lungs could not expectorate. So, when we have to prescribe in such cases, one side I had another picture of his whole life history where the patient was telling about he was irritable, he was very dominating, he was very jealous, he was a loser in his life, and one part is telling his acute totality. Now, what to select? So, what to select, Hahnemann says in his aphorism is, in acute condition, whatever the patient is throwing during an acute disposition, that is one of the most important thing we have to go for. Because during acute disposition or during an acute disease, the patient will always throw most PQRS symptoms towards you. And you have to catch hold of those PQRS symptoms and prescribe. So then, uh, this totality was taken into consideration. Now, on auscultation, there was a lot of wheezing, the chest was full of mucus, and there was a coarse rattle. So we all know the observations, which play one of the most important role in such bedside cases. So his face had sunken look. There was a strong odor around the patient. You know, when you visit some cases, you can feel there is a strong odor around the patient. So there was a strong odor around the patient. And he used to get angry on his wife. So these were some of the observations made. So such cases, when we handle with observations, they work beautifully. So the remedy, it's not important what remedy was given for the case. What was more important is what process we have to apply when we treat such kind of cases. So you have, what I'm sharing here is not a remedy, but the process. But still, I'll tell the remedy was a very simple and very beautiful remedy. In my college times, I was reading Kent, and in this remedy, in the first paragraph, Kent explained some symptoms which I could totally relate with the patient, you know. So, the first thing when we see this kind of patient, we see the expression of the face. So, the face is pale and sickly. This is Kent explains about the remedy. The nose is drawn and sunken. The eyes are sunken, and there are dark rings around the eyes. The lips are pale and shriveled. The nostrils are dilated and they are flapping. And there is dark, soothing appearance inside of the nostrils. The face is covered with cold sweat and is cold and pale. The expression is that of a suffering. And this was the same picture I could see with my patient. There was an expression of suffering, there was a lot of anxiety, there was a lot of pungent odor around him. His nostrils were dilated and flapping. And again, Dr. Ken says that the atmosphere of the room is very pungent. The more pungent, then fetid or putrid. So he said, the atmosphere of the room, when you go near the patient, the odor what you take is very important. You know, Hahnemann said in his case taking that your senses should be very sound. So what you smell when you get near your patient is very important. That directs us towards a remedy. So I always try to, I will not deliberately go, but I just try to go near the patient and try to get, if I'm getting any strong smell, any of my senses can catch anything, either my touch, either my eyes, either I can hear something, either I can smell something, because they will direct us towards the remedy, specifically in bedside cases. So the room, the odor is pungent. The family is disturbed. Yes, the patient's family was disturbed. They are going hitter and thither, and the nurse is in an excited and busy state. And then an homeopath enters the room for the prescription. And then what you see is you give a remedy and you see a quick reaction. So the remedy was very simple. The remedy I gave was antim-tart. So the question arises, what was the potency and what was the repetition? So I gave him antim-tart 200 stat. That was the only dose given to the patient. And these were all the rubrics which were taken for the case. Expectoration was like he was coughing, coughing, coughing. He was not getting any expectoration, little expectoration, he was okay. But if only on that basis, antim-tart, I may fail, because we have to match the totality of observation, right? Because such kind of cases, if you skip the correct remedy, or if you give the wrong remedy, the patient can land up into a very bad state. So we have to be very careful when you select specifically such kind of cases, the remedy. Respiration was rattling, nose, wings, fan-like motion, Hippocratic face, expression suffering, spectators sees ghosts and spirits. And one very beautiful rubric which confirmed the remedy was the patient want to cling to the attendant. So the patient said, the wife said, he doesn't want to hold my hand. He want to hold hand only of the ward boy or the nurse. So this is a very interesting rubric which gave me a confirmation for my remedy. You know, we can see we have taken picture of symptom from all the sides. The face ka expression, anxious, mind is there, particular is there, modalities are there, and the remedy and him tart. So the only drug which covers mind clinging to attendant was antimptat, and this gave me a green signal, go ahead with the antimptat remedy. And antimptat was given, and patient was given follow-up of a Saclac for 1 week, but obviously it was a acute case. So the next day I called the wife in the evening, and she gave antimptat. The patient had a very bad aggravation. I was scared. I said, why, what happened? So she said, the moment you gave the remedy, the whole night patient could not sleep. The suction which he wanted every 2 hours came to 1 hour. Every 1 hour the patient needs suction. And he had lot of expectoration. We all got scared. Maybe this was the last day of his life, or this is the last night of his life. Okay, but from next day, the suctions interval became every 4 hours, gradually 6 hours and 8 hours, and now on the second day, patient only twice a day. So this aggravation was a very good aggravation for me. I should have not got scared because, see, what had happened for this patient was his lungs were not performing well. His lungs were not able to throw out the mucus, correct? So when a remedy is given, his lungs are making a lot of mucus, but his lung is so weak, it is not able to throw the expectoration. It is not able to throw whatever it is making. So this is one of the strong indication of antimptat. So when we give the remedy, if it is a correct remedy, then what we do is we give the lungs the inertia to start working. The lungs started expectorating. Lot of mucus which was collected was just thrown for the whole night. The body was making, and it was been thrown. And it was been thrown. It gradually, I will not say it was a very gradual process, it was a very quick process. The very second day, the suction interval came down drastically, and we could see the patient got improved. And on third day of the remedy, we know that patient had paralytic ileum, like his intestines were in a state of paralysis, and the patient could not pass motions. He had to go to toilet. He had enema, still didn't pass motion. But after the second day of the remedy, the patient passed motions without enema. The swelling of his extremities reduced. So this is a very good change. And this patient of mine, the wife, she was working in one of a very good medical pharma company. She was a manager. And you know what she said me on second day, third day, I went to meet her, and after fourth day, the patient was out of the ICU. He was maintaining his SpO2 level till 94 to 98% with oxygen initially, but after 5-6 days, he could maintain without oxygen. So what she said, she said homeopathy is very aggressive, and I'm like, what? Ruti, I couldn't believe it can work so fast in such kind of cases. I was hoping it would just someone said, like, you go to Dr. Shelly, she takes care of such kind of cases with homeopathy beautifully. But I had no hope with it. But I'm surprised to see it is very aggressive in form of treatment. Then everyone was like, correct, homeopathy is very aggressive in acute treatment. When the case is very aggressive, provided if you give the correct remedy with correct selection of rubrics. So the patient was discharged after 1 to 2 weeks, and then we could see that this is all his follow-up chart which I have made. So patient was discharged, and he was follow up for 1 year with me. And in 1 year, I just need to repeat antimplat just once, that too in the second month, because in second month he came for the follow up, and he was coughing. He was breathless. He was not able to expectorate, and he just he just took out some cough in front of me and just showed me the consistency of the cough, and the cough was very sticky. It was like a chewing gum. So again, that is one of the indication of antimptat, and I repeated the dose, and he was very well with just 2 doses. Now the question arises, how did we differentiate between ipecac, antimptat, and arsenic album? Because he was restless, he was deteriorating respiratory system. Why not arsenic album? Or why not ipecac? So the major difference between antimptat, ipecac, and arsenic album for such kind of cases, even when we apply this observation in our regular acute cases of cold, cough, it works beautifully. If a patient specifically cough irritation, there is a lot of mucus in the patient, lot of cough, there is a lot of mucus, but the lungs have a very good expulsive power. The lungs are very strong and they are just removing all the mucus. So in ipecac, it is like, the lungs are making mucus and it is throwing. It is making mucus and it is throwing. And when you auscultate such patients, you can hear specifically bubbling sound. And even when the patient talks to you, you feel as if there is some lot of liquid in the lung, but the lungs are very strong. You can think of ipecac. Antemtart, we specifically should think when the lungs are in the stage of relaxation. They are tired of coughing, they are tired of making a lot of expectoration, and now they are given up. Along with that tiredness, there's a lot of weakness, there is relaxation of whole body, there's a lot of cough, but it doesn't come out. But when it comes out, the patient is better. Like the patient will cough for 20 minutes and he will remove this much mucus. But he's better after that. Think of Antemtart. And arsenic album, again, midnight aggravation is there, dry cough was there. But for us, arsenic album, the cough is better by bending little bit forward. And arsenic album will never cling tendant. He will always want to cling to his relative whom he knows, because arsenic is a very insecure remedy. Arsenic is a very suspicious remedy, and arsenic is a very fastidious remedy. So these are minor differentiating points when we make in bedside cases. They can help us to prescribe in cases. So I was going through literature of Dr. N.M. Chaudhary, and I going through his literature, he explained that a homeopath has to do three parts during his case taking. The first thing what he has to do is he has to be a very good detective. So what is a detective? Detective role is when you take a proper case, you have to hunt, why is this patient vaping, why is this patient angry, how does the patient expresses its anger, etc. You have to hunt. Once you have done with hunting, you have to be a good lawyer. A good lawyer is a person who will analyze and evaluate the case properly. He will decide what remedy, what rubric to select, why I have to select this rubric, and why I should eliminate a specific rubric. And then he has to be a good judge, because after repertorization, the doctor will decide which remedy to give. So, a case taking generally takes of three parts: your case taking, analysis, and evaluation. Now, broadly taking, a case taking is divided into two parts: subjective and objective. So, subjective is a case taking in which, whatever patient gives us information, we just feed that information and put it into a repertory chart. And objective is what we observe. So observation is one of the most important part of our case taking, which we cannot bypass it. The every movement of patient, the moment he enters, how he is entering. For example, there are so many rubrics in a repertory, where you have the rubrics of observation. You have observation in mind, like awkwardness. Now, what is awkwardness? Awkwardness is a condition in which the patient is walking, is dropping things, he is just falling into your clinic. He will just dash to your walls, he'll dash to your doors. When he is talking, he will drop his pen 10 times, or he'll drop his handkerchief 10 times. So this rubric we have to take without asking: awkwardness. So there are so many remedies, but strong remedy which comes in awkwardness is Apis mellifica and Nux vomica. Now, when a person specifically he is anxious and he gets awkward, like in the whole case taking, he is good, but whenever you ask some emotional questions and the patient becomes very anxious and he start dropping things, he becomes awkward. So what is the remedy? Deep emotions is the natural remedy. Deep emotions the magnesium group. It is a very introvert, deep remedy. So whenever you try to, get into its emotional state, Ethuja will become very anxious and he will become very awkward. Now, some remedies are awkward when they are bashful. So when they are shy, if you just, there are so many children's in my clinic, I just try to confirm some rubrics. I just appreciate the children. Oh, you're so beautiful. How you look so beautiful. You look like this actress. And they become so blushy, and then they start getting awkward. So remedies which come awkwardness when specifically they are blushful. We have Barata carb, we have carbo vegetables, we have natramure, we have sulfur and calcarea carb. What else you can observe in your clinic? Awkwardness, specifically the patient when he's doing some tailoring work, when he's stitching, when he's doing some embroidery work, and that time the patient gets awkward. He's okay otherwise. You have remedies like petroleum, natrium uraticum, conium, carbo-veg, ammonium carb. So these are some of the objective rubrics which you can observe during your case. Very critical part of casting. One more rubric I would like to just give in short is evading look of other people. So what do you mean by evading look of other person? This is again very commonly seen in your clinic, specifically in children and also adults, is whenever you're talking to the patient and you ask him symptoms, he'll look down, and then when you're quiet, he'll look at you. You ask him some questions, he'll look down, and then he'll look at you. So evading is, to not to have eye contact, but they want to be with you. So I remember a case in short I'll tell. It was a case of a thyroid, hypothyroid, and the child was just 8 years old. So I was taking his whole history, and there was this common pattern seen in him. I was asking him, he was looking down, and when I was asking his mother, he was looking at me. I was asking him, he was looking down, and when was I was asking his mother about the symptoms, he was looking at me. So I took this rubric, evading look of other person. So remedies which come are agaricus, cuprum, plumber metallicum, natrum muraticum, and stramonium. I gave him stramonium because there were other totalities for the case. So again, when you go little bit deeper for evading the look only when spoken to. Like the patient will look at you constantly, but when you start talking to the patient, he will look down for the whole consultation. He will not look up at you. You have remedies like natramure and plumbum. Okay, so these are some objective rubrics which you have to hunt during your case taking. Again, in mind section, answering how patient talks. Like there's a rubric answering dictatorially, answering snappishly, answering in a very uncivil manner, like remedy license, restlessness, timidity, yielding, frown disposed to like nux vomica. You have remedy like natramure, lycopodium. What kind of gesture patient makes in your clinic again is very important. Facial expression of the patient is very important. This is one of the most ignored part of case taking, which how the patient gives expressions when you talk to him, when he gives his symptoms. This is again very important. Some people they look very young. You just look at them, they are 40 but they look in 30s. They will look in 20s. So face expression young, you have a rubric, and remedy you have tuberculinum. This is an example. And some people eyes very tired expression. This is again very important. Fish expression in chapter I. You look at the patient eye, he looks the eyes are very tired. Lycopodium is one of the remedy. Lycopodium is one of the remedy. Extremity is knee position of inward, outward. So these are some of the rubrics which you can uh, absorb, observe during case taking, which makes your case taking more complete. This is one of the most neglected part of case taking. We all know about subjective rubrics like ailments from dictatorial, horrible things affect predominantly. I will not go in deep because we have much limited time. Sleep, dreams, etc. They all come in subjective rubrics. Art, ability for. We have some rubrics where the patient, we get medical history of the patient. Like the patient says, since I've taken this allopathic medicine, I've never been well. Or whenever I take allopathic medicine, I have oversensitive reaction. You have some remedies into it. Or skin eruptions after using of corticosteroids. You have remedies related to these rubrics also. So whenever we get any medical history strong, like history of any poisoning, history of any reaction to any strong corticosteroid, to any cosmetics like we have Bovista, or what is his reaction when he takes any allopathic medicine? Is he addicted to allopathic medicine? These are some of the rubrics which you can take for your case taking. So again, analysis evolution, not going in deep, but in this case, we have to just see the present disposition, the temperament, what is peculiar about the disease, like why this disease is different from another, which part of the system the disease is located, any concomitant you get strong, any cause, modality, time, etc. So now the question arises, uh, like uh, like why do we need as a homeopath to go deeper into the mind or deeper into the subconscious mind of the patient? So understanding the mind, like broadly, our mind is made up of four parts, like the conscious part, the subconscious part, the unconscious part, and something which we call this collective consciousness. So conscious part is a more compensated mind, how we train our mind to be. Like, this is how I have to sit, this is how I have to behave, right? Or I have to be good with people. This is a very superficial case taking when we reach only the conscious part. But when you reach to the subconscious part, like you will get to know why the patient reacted. Like for example, natriuretic is introvert, right? And natrium muraticum is introvert, and it doesn't share its emotions. She knows I will not have to share the emotions because people can hurt me, but still she tries to be good, she tries to be balanced, she will never show anger to anyone. But when you touch the subconscious mind, she will never weep in front of anyone because she knows one thing, naturally there is no market for your feelings. She has learned in her conscious mind. But when you go to the subconscious mind, you will see that natremure is a very weepy remedy. She can cry like anything. There are so many natromios in my clinic. They have cried in the end of case taking. Only when you reach to the subconscious mind, you are able to reach to the root cause of the disease, root cause of the emotions. Then you hit the subconscious mind. Then you have unconscious mind, which is more deeper, spiritual. If you say, it is related to your past lives or past karmas, which somewhere reflects at a subconscious mind and conscious mind. And collective consciousness is, we don't have any mind, we all are one mind. So it's again very deep concept. So aim is to reach to the subconscious mind. Now question arises how? How is only if we are ourselves unprejudiced, if we ourselves are very balanced. Now taking little bit of your time in this slide, as a human being, we can understand that we are not just body, right? As a homeopath, we have understood one thing. We are not just body, we are not just organs, we are not just tissue. We are something beyond that, what we call as emotions. We are something more beyond that, which we call intellect, and more beyond the spirit. So till we are balanced at all these 4 years, spirit, intellect, emotions, and body, we are in a most healthiest state. Any trauma to your emotions, your body tries to protect your intellect and spirit, and it will try to throw the disease on the body. That is why there are so many diseases which are related to mind related diseases. Now we say, like, your emotions are the cause of your disease, because your emotions, what we call as your emotions and body are closely connected to each other. There's a strong contact, matter and your mind. So whatever happens into your mind will affect your body. And then the deeper part we go is intellect, and the deepest part is spirit. So body will try to save the spirit, it will try to save the intellect, and it will try to throw disease on the more exterior part. Again, when we know we are very healthy, at the body level, when we are very healthy, we are very in a state of pleasure. In emotional level, when we are pleasant, we are state of love. When we are very pleasant at emotional level, our emotions are in very much balanced state. We are in a state of compassion with everyone. Intellectually, when we are pleasant or balanced, we are at the state of peace. And when we are very much balanced, we are in a state of joy. And spiritually, when we are balanced, we are in a state of bliss. And when we are very much balanced, we are in a state of ecstasy. So, as a homeopath, when you give the correct remedy, taking care of the patient at all the level, what we see is this remedy will balance the patient at intellectual, emotional, and body level. So the aim of homeopath is not just to give the remedy, but the aim of the homeopath is also to balance his state. Okay, so your case taking, analysis, and evaluation approach should change from case to case, patient to patient, and from disease to disease. So again, not going deep, but case taking is different in syphilitic cases, in acutes, in chronic cases, in one-sided cases, and in mental diseases. It changes. We have to understand. Last case with which I end the presentation. I think okay, it is a case of Alzheimer's. This female had come for she was admitted in hospital and she was in the last state of Alzheimer's, and she had a sudden collapse, no body movements, blood pressure was more than 200, systolic and diastolic was more than 100, and she was not responding to any uh, disease, any treatment in the hospital. So her electrolyte imbalance, hypoglycemia, not responding to any commands. She was getting more drowsy, and she had a gangrene which was wet and very bad smelling. So this was a situation. So now such cases can be dealt only with observation again. So seeing the patient on inquiry, we could see there's a sunken look in the face, bad odor to the discharges, and bad odor to the mouth. She was in the state of sepsis. So there is no strong, clear history. The patient is a very syphilitic case. We have very less time to decide, and remedy was clear. It was remedy Bacteria tinctoria because it covered all the symptoms. Like it is a very fast syphilitic remedy, Bacteria. Then you have intoxications condition in the patient. The patient is unconscious. There's a lot of offensiveness and stupor. Like whenever you ask the patient something, he'll go back to stupor. You ask something, he'll give answer and go back to stupor. And one beautiful observation which was there is mouth open during unconsciousness, and you feel the patient is there. So this rubric was observed, and the remedy which came in this rubric was again Bacteria. And Bacteria remedy was given 200 stat. Follow patient got consciousness after next day. Then he was shifted to ward and discharged. I have the video after 7 days ka, but I will not be able to show. But the patient started giving respond to the comments, whatever the patient we were asking her. She was watching. Gradually, she was able to sit. She was watching television, and she was in a much better state with just single dose of Bacteria tinctoria. The rubrics were confusion, soreness and heaviness of body, intoxicated feeling, fall asleep when spoken to, sepsis leading to delirium, offensiveness of discharges, rigidity of muscles, distorted look. Again, this is very important for bacteria, and lifeless body. So, with this, I would like to end my presentation for today. And if we can be connected through my email address and my YouTube channel. Thank you very much, everyone, for the wonderful opportunity I got. Thank you, Uta and Genoveva, and thank you, Dr. Karthik. Okay, take care.
And we hope to have you here with us a few more times. Thank you very much, Dr. Shelly. We'll just wait for Dr. Alpesh to log on. He's already logged on. He should be coming in a minute or two. Yeah. Dr. Alpesh, we are not able to see your video. You might have to give permission for your system to use the video. So while Dr. Alpesh is coming, I'd like to welcome all of you on behalf of Get Well with Homeopathy to a series of seminar that we've organized. We've got yeah. So uh, request you to all check in every afternoon at around 4 o'clock GMT, depending on the schedule of each speaker. Dr. Alpesh, can we hear your voice? Can you speak up?
Hello.
Yes, Dr. Alpesh. Hello, how are you?
Yes, can you hear me?
Yes, I
Yeah,
can
I'm
hear
good.
you very well, and I hope
All
everything
right.
was all right with the Bombay storm going over Mumbai.
Oh, yes, it was a minor thing.
It was a minor thing, is it? Okay, good to hear that. Good to hear that. I
Yeah,
won't take much of your time because everybody is
yeah,
eagerly waiting to hear you speak.
yeah.
So,
Yes,
yes, you can go on. You can go ahead.
sure. So, thank you for this wonderful initiative, which is required in today's time where awareness of homeopathy is very important. And myself, Dr. Alpesh Oza, I am here to share some few interesting cases of it will be more about what you need to find out in the patient to cure them with homeopathy. So I'll proceed in sharing few things, which is a patient comes to you with blood reports and lands on your table. So you need to think about what is actually happening with the patient, and there are no physical symptoms disturbing. So what do you do in such a case? In homeopathy, we try to investigate the patient. We ask them what is happening with them, how are they affected with different things. Not just the reports matter, but also how they are affected with something which is disturbing in their life pattern. So that is what we need to do with homeopathy and the patients which who approach to us with homeopathy. So similarly, this patient landed up to my clinic. I'm Dr. Alpesh Oza, and I have been practicing homeopathy since the last 12 years. And I practice in a suburb of Mumbai, which is like 1 hour from the proper Mumbai city, not too far, but the outskirts. And there are a lot of middle economic group and the uh, people people who go on a daily work and work from 9 to 5, and so businessmen. There are variety of patients. So you may have some case which is like this, where he says that I'm having uh, sugar in my blood reports, and how do I do, please help me. So we need to find out what do we do in such a case. For example, here the sugar was around 200 and 300, and there are no physical symptoms disturbing the case. So we ask the patient, what is it that is affecting you? And he tells us that there was some stress of business, and I had some dispute with my brothers, and the brothers didn't take him into confidence for certain decisions, and that is why he got affected. And these reports were from June 2016. So it was quite a task for me to open him up and ask him about how and what affects you the most. And further to this, he told me that when I asked him that what do you like to eat the most, because these are the physical journals we look for. What is it that you like the most? Is it cold? Is it hot? And he shared with me that he likes to take cold drinks. He likes to take buttermilk. He likes to take cold milk and all, which was a very peculiar sign for him. So in homeopathy, we try to find out this peculiarity. Individualization is called. Suppose I take a phone today and I want to customize it the way I want. I want to put a wallpaper which I like. I want to put the apps which I like. I'm trying to customize things. That is what we do with patients in homeopathy. We try to customize the case taking according to the pattern they present to us. So going further with this case, he shared with me that he has a good sleep, good stools, urine, and no other physical symptoms which were disturbing. But he had dreams of falling from a high place, which is quite interesting. That when we see what is happening in the dream is actually happening in his real life. He is falling from the position of between his brothers. They are not supporting him or taking him into confidence for taking a decision, and he feels that he falls from that place. So when we see further more about him, he tells that there have been quarrels, and they tell him anything, and he feels bad about it, and he tells that they were planning few things since a long time, and I don't know. I really had some internal feeling about it. No one came and told me, but I had an internal feeling about it. And since that bout of quarrel I had with my brothers, I have not interacted with them. I set up my own parallel business. I planned for it so that whatever they do to me, it doesn't affect me. This was the state of the patient. So when we understand his case, we take few rubrics in homeopathy and we try to plot them in the repertorization sheet which you see on the screen. We see that it's more of like contradiction ailments from aggravated him. He felt neglected. It was a delusion he had, which was also present in reality, but it was more for him because he was in that situation for a long time, and then dreams from falling from a high place, and then he is a businessman and he gets aggravated a lot. And then the physical symptom which he shared was that milk desires. So the two remedies which come up in this case are sepia and elapse. Now, how do you differentiate this remedy? It is very important that we individualize even further to reach to the right remedy and understand the pattern of the patient. So how do we do that? When we analyze the case from the synergy method, which is one of the approaches in homeopathy that we do, it is seen that this patient had a feeling of things, neg- feeling of neglect. He had the things of planning few things against him. There are some things which are plotted against him, and he's become a victim. So this belongs to the animal kingdom. This belongs to the reptile family and Elapidae family, because the patient had the feeling from shuddering from least contradiction. He used to tremble when anyone used to tell him anything. He desired buttermilk and felt cold when the drinks used to pass through the stomach. He had a dream that he falls from high places. All these three things when we combine, it comes to the remedy elapse. So we have the system on one side, on the right hand side of the triangle in the bottom. On the left hand side, we have the symptoms, and on the top, we have the genius, which which is like the essence of homeopathic remedy, homeopathic materia medica of this remedy. So in this way, I started in with ELAP. This was in June 2016, quite 4 years ago before today. And when you see the reports, his sugar is very well under control. It's now around 167, 170. He used to hover between 200 and 250, and then between 150 and 200 in the last 1 year. And now he's very much under control. If you see the reports in a systematic order, in the first case, during the first new case time, he had a sugar fasting level was 253 and the post lunch was 314, and slowly it came down to 137, 153, then 99, 93, 108, 143. Again it rose little bit in 2017 to around 169, 220, but this has been the state for him since a long time, and that is the reason it is very important that homeopathy, only and only homeopathy is helping him. He has not taken anything apart from homeopathy for all his complaints. He must have had cold, cough, he must have had fever, he must have had skin problems. He has reported to me every time during the last 4 years. That is the trust that this patient has. So in this way, we can customize the treatment for all the patients and try to understand their case and reach to a remedy which helps them to improve not only physically but also from the pathological point, from the holistic point, from the stress point of view. And slowly this patient also got free from his feeling that he has been neglected, or he feels that there is some planning going on against him, or he felt bad when the brothers abused him, or there was a quarrel in future also in the last 4 years under the treatment. He's much confident, he's much stronger, he's much good energy wise. That is how homeopathic medicines will help such patients. So what we do in homeopathy, let me take you back. What we do in homeopathy, let me take you back. What we do in homeopathy, we understand the patient behind the disease. Patient may land up to your table with some reports, with some medical condition name which is very strange. This is the anamnesis which the old school authors follow, old school teachers follow, the allopathic medicine follow. And we don't have to do that. We have to understand the patient, observe the life pattern, we have to understand the story. And once we understand that, we try to reach the right remedy by analyzing the case, by repertorizing the case, and by reaching to the right remedy. I'll move on to share another case of thyroid, and very interesting case. The patient came similarly to the other earlier patient. She also landed up with a few reports, like the TSH, which is the thyroid stimulating hormone. This was around 14.773, which is very high as compared to what her age is, what her situation is. The T3 was 59, which is also a little bit low than as compared to what normal it should be. So she has been affected with some things which are going on in her house, and she was not telling about this. Most of the thyroid patients which will land up in your clinic will usually have the feeling of being oppressed or suppressed in their homes. They would not be able to express themselves, and that is why the thyroid report will, fluctuate either between low or high, and that is your task to find out. So let's move on to find out what was the story with this patient. There was lot of stress. The husband abused the patient and she couldn't react. She used to feel that I want to answer to that uh, my husband, but I can't answer. Why? Because it's of no use. Sometimes I feel that I should answer and answer him back, but I feel it is of no use. And this is the story since the last 5 to 7 years. And I don't know how to react. I feel hurt in spite of doing so much, and I feel in spite of doing so much, I'm getting back in this way. So I wanted to, I don't know how to find this solution for this particular situation. Can you help me? And what we can do in such a case is that we need to individualize how is the stress affecting her, how is the abuse affecting her, how has been her reaction to it. Sometimes she feels strong that she wants to react to it, but sometimes she feels no, it's of no use. So there is an alternating state, and if there is an alternating state, we need to find this particular rubric. We need to find this in our books, in our materia medica, in our repertory. And once we do that, we can reach to the right remedy. In dislikes, the patient had lemon and sour things. She didn't used to like it. Otherwise, all the other physical journals were quite normal. So in cases where there is a lot of pathology involved, there may be very less deviations on the physical journals in most term of the cases. And we need to understand the patient from the mind aspect, and that will lead you to the right remedy. So when we reach to the analysis and we see that there was aggravation from lemons, there was constant desire to swallow. So whenever this patient used to come and talk to me, in couple of minutes, I used to try to ask her about her state, about what is happening with her, and she used to, yeah, and she used to talk to me, and then she used to deglutitate the saliva. So this is a very important observation which you need to do in your cases. You may just not take the case, you may just not see the reports, but we may need to understand what the patient is doing while the case taking is going on. With what are the observations that you have had. And then there was this suppressed anger, which was also one of the key things in the case. And there was alternation of states. At one time she used to feel that she can react to her husband and fight back, but at other times she used to say no, there is no use. And then this way we reach to the rubric courageous alternating with discouragement, and the remedy is staphysagria. So once we understand that, we know that there is a very peculiar rubric of staphysagria, and when you go to our source books, that is Kent lectures on homeopathic materia medica, there was a case where a particular person was abused and he went home without retaliating, and he suffered a lot of consequences because of it. So the patient was a staph case. This is mentioned in the Kent's lectures of homeopathic materia medica. In similar way, you may have patients in your clinic who may not be able to react to some situation, to something, and they will always try to take it inside. And the way of taking it inside is when expressing their symptoms, also they will try to swallow. So the rubric for this would be swallow constant disposition to excitement emotional aggravates. Whenever she is sharing about her life history, she is trying to swallow the saliva, and that is why the remedy, two remedies are mentioned very importantly in this case, in this particular rubric: endocrinos and staph. And when we see the other rubrics of the case, the staphysagria remedy was more closely coming in this case, and it was started and it helped a lot. So you see, when we take this particular rubric also, we come more closer to the remedy. Although lemon saccharate is not covered in staphysagria per se, but it is covered in another similar remedy of the same family, which is pulsatilla. So we have in the same family ranunculus, the remedy which uh, would match this particular pattern. So with staphysagria, the patient improved a lot. And if you see the synergy method, which we should always follow, and it will help us a lot. So it is like you have the system which is ranunculus. She felt hurt, she felt injured, she felt insulted, suppressed. And in Patak Materia Medica, we know the genius that she is sensitive to what others say about her. And in symptoms, you have swallows continuously while talking, lemon dislikes, anger suppressed. So in this way, we are more closer to the remedy because of the analysis which we follow. Staphysagria was started, and in few months you can see the reports of thyroid got reduced to 2.93 from 14, and in this way the patient also improved physically, and she could handle her situations in the home, the abuses by her husband more calmly, and she could answer a few times to make herself live and feel better. So in this way, in homeopathy, we need to individualize. You have to many of such cases will be oppressed, will be suppressed, but you need to know the story. You need to understand the patient and reach to the right remedy, which will help even more better to the analysis to the patient also. Interesting case, most of our homeopathic fraternity usually nowadays have cases of fibroids. So I had one such case, and there will be a common say of the patient. There is irregular periods. I have pain here in the abdomen, pain there. There have been lot of bleeding. There have been less bleeding, and so on and so forth. There may be climatic patients who will be affected with this problem commonly, and will not have much symptoms in the case. So this lady came to me in 2015 with reports of fibroid in the uterus, the size being 40 by 40 millimeters and 26 by 34 millimeters, which is a very huge fibroid. Now this lady has been affected with lot of troubles. There was uh, the death of her husband, which was one of the major reasons. The other thing which affected her was her son, who is a grown-up child now. He is in her in his teenage now, and he is going to the school, and he'll be clearing his school exams soon to go into the university, to go to the college, and there was lot of stress in her to manage her son's career and his further life, and all responsibility was on her. So there was this thing which was going on, the husband which had expired. There was lot of grief in her, the responsibility of the son which was there, and in this way it was a very simple case where aurum mute natronatum, this is the remedy which was given to her. And you can see after a few days, like in couple of years, because fibroid cases will take a lot of time. They will require lot of analysis, and not only one remedy will help, you will have to change the remedy often. And in this case, if you see, in 2 years, so you can say that patients may go to surgery and gynec, and they can get operated very soon. It can be a possibility, but the effects of getting operated and how the result would yield, the disease may shift the location. That would trouble the patient more. So this patient fared better with autoimmune nitronatum. She stayed with me, and in 2017, 2 years after the first sonography report, her fibroids reduced by around uh, 10 to 30%, 20 to 20%. So they came to around 34 into 32 millimeter. The earlier size was 40 by 40. So we continued the treatment, and by 2019, which is recently last year, the fibroids have reduced by half, 20 by 20 millimeters and 19 by 17 millimeters. So the patient is much calm, much better. She can handle things much easier. There is less stress. She doesn't feel much bothering, much stress about her son now, and she can manage her home situation also with ease. So in this case, you have to understand the deeper patterns of the case. In this fibroid case, it was more of the responsibility which had come on her head because her husband was not alive, her son was alone. There was a grief, and in such cases, aurum natronatum, which is a very good remedy for fibroids also, this helped the patient. You can see further before treatment, the sonography report, the sonography of the abdomen report says 40 by 40 as the fibroid size. And then slowly and gradually it became around 25 to 30 millimeters. And then it's even lesser to 20. Now recently a sonography has to be done, but due to the lockdown, she couldn't do it. But soon as we will plan to do it, the result is very favorable. It is expected to be good, and in this way, different cases of homeopathic uh, different cases of pathologies can be helped by homeopathy, and these are the remedies which have been given to the patient. We cannot be specific about what remedy can be given to fibroid because every case is different. We started with Aurum neonatum, moved on to Calcareas because she was a climateric lady. She was having palpitations, there was headache. Calcarea suits these patients very well. And then I moved on to Calcarea because it seemed more like now she became more security conscious, less of responsibility, but more security conscious for her child. So patient got from one state to another state, and in this way we can improve with the patient and see whether the same remedy pattern matches or the different remedy pattern matches. Patient can belong to any family, any kingdom. It can be plant, it can be mineral, it can be animal. So it's up to the patient to describe that sensation to us to understand is our challenge. The strategy in hormonal cases would be more of internalization of the feelings to see the pattern, what is happening with the patient. And in this way, we can reach to the right remedy. There will be very less symptoms. The patient would not be able to express more, but maybe we can just investigate more, get more comfortable with them, let them be more comfortable with us so that they can be free to express what they want to express, and in this way we can reach to the core of the patient and understand what their actual feelings are. In this way, I had just a few cases to share about the different hormones or the way it affected them. All were different cases. Like you saw one case of animal kingdom, you saw another case of a plant kingdom, the third case of mineral kingdom. It can be anything, but it all depends on how you analyze the case, how you understand the patient, and how you reach the right remedy. So I have mentioned my email ID, dr.alpeshoza, dr.alpeshoza@gmail.com, and I would await your good feedback and, of course, your suggestions on how different things can be improved for the patients from the homeopathic point of view. And let's work together to take this science more ahead in a better way. I thank the organizers of Get Well with Homeopathy to uh, take this initiative in a much larger way. And this has been an incredible journey for all the homeopaths to learn different things from different authors in this group. And that's what I had from my side today. I thank very much to the organizers.
Thank you, Dr. Alpesh. And on behalf of Genoveva and Uta, I'd like to thank you and Dr. Shali as well for the wonderful
Yeah,
seminar on hormones and how homeopathy can help. And we have a lot to learn from you, and it's nice that you share so much of information. So we have homeopaths who can improve themselves, learning
yeah,
from case studies that we share. Just to tell you that we have tomorrow we have Ileana and Dana, who should be coming on by about 6 o'clock GMT, which is about 10:30 Indian time, and respective times whichever part of the world you're in. So we look forward to having you back again, and see you tomorrow. Mm, and if there's anything you'd like to if there's any other speaker you'd like to get on, you can just message Genoveva or Uta, and they'll be happy to bring them on and help everybody become a better homeopath. So, with this, we'll see you all tomorrow morning or tomorrow afternoon, whichever part of the world you're in. Good night and